Setting hospital outpatient clinic. Your patient is 50 years old at the outpatient clinic for a hernia repair. You see the patient to carry out preoperative checks. Now let's see the task. First one says confirm reason for the patient's admission. Hernia repair. Check patient compliance with preparation instructions. No food 6 hours. No fluids for 2 hours. Second one says explain patient needs to be nil by mouth. Risk of vomiting and anesthetic. Third one says advise need to do clinical observation. Check if patient has had any recent illnesses. Fourth one says explain pre-clinical observation steps. Put on hospital gown, compression socks, non-slip slippers, take off valuables and jewelry. Fifth one says give reasons for removal of all jewelry. Possible need for electric current to seal the blood vessels. Risk of burns due to metal jewelry. Sixth one says describe next steps. Doctor to check personal and medical details. Give information about gain consent for procedures. Seventh one says find out patient's post-operative arrangements. Research giving timescale for discharge. Discharge requirements. Vital signs stable. Ability to tolerate food, fluids and pass urine. The last one says establish consent for you to begin the clinical observation. Hi, good morning. My name is Anna, one of the nurses working in this hospital outpatient clinic. May I know your full name for the confirmation?
Good morning, Anna. I'm David and I'm 50 years old.
Hi, David. Please tell me the reason for your hospital admission.
Sure. I've been admitted here for hernia repair surgery.
Thank you, David, for your confirmation. Today, I'm here to carry out preoperative checks before the procedure. So may I know if you have complied with preparation instructions as advised by the doctor?
Yes, nurse. I have followed all the preparation instructions as advised by the doctor. However, I'm feeling a bit thirsty now, so I would like to drink some water.
I can understand your feelings, David. However, it is essential that you need to be nil by mouth before the procedure. That is, you are not allowed to take food for 6 hours and no fluids for 2 hours prior to the procedure, because it is important to avoid food and fluids through the mouth in order to avoid the risk of vomiting and anesthetic. I hope you're following me.
Yes, nurse. I understand it now.
I'm glad to know that. Before proceeding further, I need to do your clinical observation before the procedure. May I proceed, David?
Sure, nurse.
David, did you have any recent illnesses?
No, nurse. Fortunately, I haven't had any health problems recently. I've been feeling better.
Good to hear that, David. Now let me explain the pre-procedure steps and the pre-clinical observation steps. May I proceed with that?
Please, nurse.
First of all, you need to change the clothes and wear a hospital gown along with compression socks and non-slip slippers. Thereafter, you need to take off your valuables such as jewelry.
Nurse, I wish to keep my watch on so I can check the time when I wake up.
I understand your perspective, David. Try not to be worried. I can explain to you the reason for the removal of all jewelry or watches before the procedure. During the procedure, there is a higher possible need for electric current to seal blood vessels. Therefore, there is a risk of burns due to metal jewelry. In order to prevent such complications, I would highly recommend removing the jewelry and valuables before the procedure. I hope you understand the importance of removing jewelry and valuables before the procedure.
Yes, nurse. I understand that now. I will take off my watch as you instructed.
Glad to hear that. Now let me explain to you the next steps. That is, there will be a medical examination by the doctor and he will check your personal and medical details and other necessary observations. Then you need to provide the consent for the procedure. And finally, the necessary information about the surgery will also be explained to you in detail. I hope the steps are clear for you.
Yes, nurse. Thank you.
Okay, David, I would like to know about your post-operative arrangements to go home.
Nurse, my daughter will be coming to pick me up after the operation, but I need to tell her what time to pick me from here. So, how long should I be here in the hospital after the procedure?
David, unfortunately, I cannot confirm the exact time scale for the discharge because there are several factors to be considered before the discharge process. Please set your mind at ease. I will explain to you the discharge requirements. First of all, your vital signs need to be stable after the procedure. Along with that, you should be able to tolerate food and fluids properly. Above all, you should also be able to pass the urine to provide the discharge. Therefore, these measures show your readiness for the discharge. So, I can assure you that you will be discharged once your health condition is really satisfactory. Do you have any more concerns to be clarified?
No, nurse. Thank you.
Okay, David. Can I have your consent to proceed with the clinical observations?
Sure, nurse. I'm ready for the pre-operative checks.
Thank you, David. I would like to summarize what we have discussed so far. Until now, we have been discussing the pre- and post-operative requirements. I hope you understand that. Now, please be seated here. I'm going to begin the clinical observation. In between, if you have any questions, you can ask me. I will be glad to help you. Thank you, David, for your valuable time. I wish you a safe procedure.
Thank you, nurse. Thank you very much.
Thank you all. A role play and see you.